Hello everyone, we are in the pre-operative arena for a patient post rhinoplasty and lip revision. Now yes, she did have a cleft lip. In her words, it was incomplete cleft lip which she got operated right after her birth. This was done years back, and as we can see, that corrected the notching that is over in the upper lip on the left side. That was not the only surgery done for her. She has undergone 2 more surgeries, and all these previous surgeries have been done elsewhere. The first one, as in her own words, was a cheiloplasty, which was for the cleft lip correction. The second one, as she says, was again a revision surgery for the lip. It was a lip revision, so as to say, and for that she basically wanted the philtral ridge to be uniform, the white roll matching, that is the lip to have a continuous borders, and the cupid's bow. By cupid's bow I mean the V shape should be symmetrical on both the sides. The third surgery which she underwent was not very long back, which is 1.5 years back, and there they've used a ear cartilage. Ear cartilage, probably we are assuming as a full thickness flap over this region such that the scar is masked completely. Also, the lower lip had a mucosa which was taken for the reconstruction of the labial bow. So 3 surgeries done so far only for the lip, but the first time ever she will also be approaching for the nose. As far as the nose is concerned, her only concern is the alar asymmetry. If you look a little up, we see that there's nasal tip is depressed and there's alar asymmetry when compared to the left one, because the left alar rim is depressed as compared to the right. For her, the cleft nasal deformity is not very marked, mainly because it was an incomplete cleft lip, as she says. But because of the continuous revisions that she has undergone, she feels the scarring is more and the nose needs some kind of correction. So it's a cleft nasal deformity which she wants to be corrected, not much of cosmetic improvement. But we have seen her scans and we have told the possibility of rib harvest, mainly because the tip lacks support and also because the alar rim needs to be reconstituted or reconstructed, so as to say. So it will be a cleft nasal deformity correction by Dr. Richardson by an open structure rhinoplasty and lip revision for her. Thank you. We'll follow it up inside.
This cleft revision lip surgery and also a rhinoplasty. And this is how the patient is looking right now. You can see the tip is drooping, a severely deviated septum. You can see that tip, and there's asymmetry as well, which you can see in this view. The tip is towards the right side. Dorsal aesthetic lines are not symmetrical. You're going to be fixing all of that, and also the lip to start with. You can see there is a mismatch in the thickness of the lip and the grooving around the scar, and the asymmetry also the alar base. Completed with this cleft rhinoplasty, and to show you how she looked before. Front view. before and now. Okay, basal view. So you see it was collapsed and very broad. This is where there's maximum change, and this is for now. You can see the proportional improvement. So this is day 8 now. We've done a lip revision with rhinoplasty. It's a very challenging one because it was a cleft issue. She'd had a few revisions done before. We're going to show you in a while. Okay, so தண்ணி வர மாட்டேங்குது. ஓகே பாருங்க, give it a mirror. பிடிங்க. எப்படி இருக்கு? சூப்பரா இருக்கா? ஷார்ப்பாக இருக்கு. இன்னும் சரியா யாருக்குமே கண்டுபிடிக்க முடியாது. ரோஸ் சூப்பராக இருக்கும். இன்னும் நாளைக்கு டைம் ஆனால் இன்னும் நல்லாயிரும். நம்ம அந்த பெண்டு எவ்வளோ வீதி கம்மியாக இருக்குது பாருங்கள். இங்கெல்லாம் இந்த வீதி, இந்த ஷேப்பு, சென்டரில் இப்படி வச்சு பார்த்தா மட்டும் கொஞ்சம் உங்களுக்கு தெரியும். ஆனால் யாரும் கண்டுபிடிக்க முடியாது. அதை எனக்கு தெரியும். பட் இதில் உதட்டு பாருங்கள், ஷேப்பு கீழே பாருங்கள், இப்படி கீழே பாருங்க, தெரியுதா உனக்கு? So this is day 8, and I'm going to show you. You're seeing all the different views of the nose, and I'm going to show you. Yes, this view I think you can really appreciate that the tip is having nice support now. It didn't have enough support. There was a bent tip. It was drooping. It was also too broad. You can see that drooping tip. Yeah, side paranga. In the side. And you can also see the proportion of the upper lip. Inga upper lip paranga. Ninga na kannadila paranga. Paranga upper lip lighta. Therida? So you can see the upper lip, lower lip proportion was not correct then. Now it's correct. Upper lip is ahead. The tip is in the right proportion. There again you can see that. Sorry. So you're going to go back to the first pictures. Now you see this. Loose avudunga nera parunga. So you can see the, let me show you. Here you see the lower lip was pouting. I've done no surgery to the lower lip, but I've done surgery to the upper lip. It was too wide. We've narrowed it down. I've increased the tubercle midline. Little bit of scar revision. Is still firm, but it's going to get better than that. A lot of work on the muscles all the way from inside. And then the tip, you see the tip here, it was droopy, bifid, and also not straight. So that has been narrowed. Osteotomy has been done, radix work all the way up to the tip and the alar base. இன்னும் பெட்டர் ஆகும். only 6-7 days. சிரிக்கிறவள கரெக்டாக பல் தெரியும். Okay, right. நல்லா இருக்கா? You want to tell something to our subscribers? You can tell something. சொல்லுங்க, no problem. You can tell in Tamil. நீ சொல்றீங்களா?
ஹலோ. ஆமாம், ரொம்ப சந்தோஷமாக இருக்குது. நல்ல சேஞ்சு அவங்களுக்கு. ஸோ முன்னாடி ஃபோட்டோஜெனிக் ஃபேஸ் அந்தளவு நம்ம வந்து பார்க்க முடியாது ஃபோட்டோஜெனிக்கில். நவ் ஐ திங்க் ஷி அண்ட் டாக்டர் ஹஸ் டன் அ பர்ஃபெக்ட் ஜாப். ஸோ பார்த்திங்கன்னா நல்லா ஸ்ட்ரைட் பண்ணியிருக்காரு நோஸை, அப்புறம் லிப்ஸு வந்து ஸ்ட்ரைட்டாக இருக்குது. ஸோ இந்த காரியங்கள் வந்து ஷேப்பு கரெக்டாக பண்ணியிருக்காரு. ஸோ அதனால் டாக்டருக்கு ரொம்ப தேங்க்ஸ் சொல்லிக்கிறேன் நான் வந்து. தேங்க்யூ.
Everyone, we have a patient almost 45 days post her surgery. She underwent a rhinoplasty and a lip revision at our center. As we can see, it was not a primary rhinoplasty, not a primary lip revision, so as to say. Dr. Richardson was the almost third person to operate on you. She had lip revision or a cheiloplasty in her childhood, which was the first one. The second one being about 5 to 6 years back. Also, in that lip revision, a ear cartilage for her was harvested from the post-auricular region. So now as it stands, it is a lip revision which is done, a tertiary one by Dr. Richardson here. We can still see a thin line on which he is applying scar cream even now. But if we have a look at her pre-operative picture, this was taken about 45 days back. Yeah, so her problem was about her lip shape, about a blur scar which we had, a notched up one along the left region, just lateral to the philtrum, and also the lip thickness was not so prominent on the left side. So if we see, the cupid's bow is restored, the lip fullness has been restored on the left if we zoom in and see very minutely. Also, rhinoplasty has been done for her. It was a cleft nasal deformity, as we can see. The left alar base was depressed. If we look up a little bit, yes, we can appreciate that. Rib harvest was taken. That was for the dorsal reconstruction. Ma'am, if you can look on one side, so we can show you the results. Yeah. So we see a slight hump over here that has been reduced. It's quite harmonious now, right from the radix to the tip. You can turn on your right a little bit. Yes, look up a little bit. So this is a follow-up post rhinoplasty and lip revision almost 1.5 months later. Thank you.